Okay, Heath, so we did, our first question was, should I whiten my teeth?
Yeah, well, firstly, I would say yes, and it's like a question I get asked daily when I'm in my own practice. It's something that it's so simple, that it's so easy and generally kind of inexpensive to do. So for most people, it's quite suitable. The results are usually quite good. So I'd 100% say yes, it's worthwhile. But just I would certainly just qualify that and saying, there are a few occasions where it's not actually not the best thing to do for certain people. You may not get a great result, or it may cause, like sensitivity as well. And just to go back a step here as well, so there's a few ways that you can whiten your teeth. The first being probably what we're talking about here, and it's using like a bleaching product or whitening product on the surface of your teeth to whiten all of your teeth. You can also get veneering done that makes your teeth whiter. You can do internal bleaching, so it's if you've had a root canal, you can whiten that tooth up, and then you can also abrade teeth as well to make them whiter. But 99% of the bleaching that's done, the whitening that's done, is that external whitening, which is what we're going to talk about today. Yeah.
Yeah, cool. Okay, so is there any sort of side effects that people should know about when they're making the decision to go with whitening?
Look, typically I warn people that they'll get some temperature sensitivity, like cold sensitivity. That's usually really temporary, if at all. There's also some chance of getting irritation as well on the gums. So I would also, once again, discuss that with your dentist. Some people are kind of a little bit more sensitive to the whitening products. It doesn't necessarily mean you're not suitable, but just something to be careful of. It's not safe for younger people as well. So if you're under the age of 18, usually you'll get a lot more side effects with sensitivity. And then if you're pregnant or you're breastfeeding, it's also not suitable as well.
Excellent. Okay. And then there's certain types of, like if you've had pre-existing like treatment as well, that tends not to whiten with like fillings and crowns.
Yeah, that's right. So if they're at the front of you, in the front of your smile, you probably want to be very careful, or at least go into it knowing that you might have to get any kind of existing dental work replaced. Because as you put the whitening product on yourself, or if you're doing it in the chair with the dentist, it will lighten only natural tooth structure. So if you've got crowns, fillings, a denture tooth at the front or something like that, then you just got to be aware and be able to sort of tackle that problem if it comes up and it contrasts between the two shades.
Yeah, so just I guess going into it knowing that if those particular things at the front, like you've got fillings or crowns, that you might have to have them replaced if the shade is really contrasting. So
yeah, absolutely. So it doesn't mean you can't do it. It just means you've got to have a plan in place, and your dentist will tell you that straight away. So if you're querying them about it and you go into it, they would have probably already flagged that with you too. So it can increase your cost and the amount of time you spend in the chair as well. But that's something I probably almost daily do, is replace fillings for people because they've had whitening done and it's sort of a bit darker. So it's all part of the process. It's really fun. It's like the best part of dentistry for me. I get to change people's smiles very quickly and usually really cost effectively too.
Yeah, absolutely. So on that, how much does it normally cost for whitening?
So you can get like a do-it-yourself sort of kit, which doesn't involve a dentist. I would tread a little bit carefully with that, but they can be quite inexpensive, from stuff you get at the pharmacy for $20 or $30 or even less. The ones that you get from your dentist, so there's the take-home trays. So that's a kit with a customized tray. They usually range, from sort of a couple of $100 or $300 up to maybe $500. So there's a whole variety of different types, and they do vary. You can be really lucky. Sometimes there's some dentists who are just starting out their practice and they do offer some really, really good deals. So I've heard of, dentists offering things free, or at least some special offers as well. So watch out for that. If you want, so the premium sort of product is an in-chair system. So that usually is a lot more expensive, around sort of, I have seen it for, $500. It can be up to $1,000 or even $2,000 when you're doing some sort of like a laser bleaching, which is really cool, but it does cost a bit more.
Yeah, absolutely. And lastly, a big one I get asked too from patients is, how long does it last?
Yes, absolutely. It really varies. I love my coffee. So for me, when I whiten my teeth, it just reverts back probably within 3 to 6 months. I mean, the great thing is with these products, you can just reapply them and you can do a maintenance. So it's usually with a custom tray, and it will take 2 or 3 days perhaps of use, for an hour or so a day, and that'll bring you back to kind of where you were after you first had the treatment done. So it ranges. Some people can last for even years, but I would suggest people have in their minds that every 6 months they might want to do some kind of maintenance, which is usually inexpensive and very easy that you do from home.
Yeah, absolutely.